Welcome everyone here to Andy's YouTube Food Skepticism, and today's episode is number 8, Iron Deficiency Anemia, by popular request. So I want you to imagine something. Say you're a physician or a dietitian or somebody working in the hospital, and patient comes in and they're visibly pale. They complain of tiredness and weakness all the time. It's an adolescent female, and no heavy bleeding or anything like that, but you do some blood test and you find that her red blood cell count is really low, as well as mean corpuscular volume, which is MCV. It's the size of the cell, and a few other factors. And you go, well, I suspect this person might have iron deficiency anemia, and you'd be right. Of course, there's a little bit more to it than that, but this is something that's commonly seen in a lot of hospitals. Iron deficiency anemia tends to be one of the more common vitamin and mineral deficiencies in the United States. The United States actually has a handle on quite a few deficiency disorders, but this is one that we're still struggling with for various reasons. So just an overview of some of the topics we're going to go over. We're going to go over the definition and diagnosis. We're going to talk about some of the signs and symptoms of iron deficiency anemia. Etiology, or the cause. How does that progress? Prevalence, or the commonness of it. Risk factors, as well as treatment, and we'll cover nutrition as well. And I'll give you some recommendations to close. So first things first. Iron deficiency anemia is typically diagnosed when a person has blood levels of low hemoglobin, or Hg for short, and a red blood cell count, RBC. This and some of these other indices that I'll go over here in a second are part of what's called a complete blood count, or a CBC. This is something that your doctor will typically order about once annually, and it gives them an idea of what's going on in your blood and what's going on in your body. So what are some of those other things that you will look for if you're a medical provider? Well, you're going to look for low mean corpuscular volume, which really just refers to the size of the cell again. In iron deficiency anemia, it's really small, and we'll go over why that is. Other indices include low hematocrit, or HCT, low mean corpuscular hemoglobin, low mean corpuscular hemoglobin concentration, and low ferritin. If you're not really sure, ferritin is actually a protein that helps transport iron, and it's just something important to keep in mind. Okay, so I want to cover something real quickly. There's two basically broad categories of iron. One is called heme, and the other is called non-heme. Heme iron comes mostly from animal meats. It tends to be more absorbable. It has an absorption rate of about 20 to 30%, which when you're talking about iron is pretty great because iron is notoriously unabsorbable. Non-heme iron comes mostly from plant foods, dairy, and eggs, and it's frequently less absorbable. We're looking at a range of about 5 to 12% absorption. Also, something about non-heme iron, it tends to be more greatly affected by other interfering minerals that are being absorbed and whatnot. If you're an omnivore, I'm just going to tell you right now, if you combine your heme with non-heme sources, it actually ends up increasing the non-heme absorption, which is kind of like a little fun factoid here, if you're interested in analyzing. So some signs and symptoms of iron deficiency anemia include tiredness or fatigue, dizziness, headaches, pale skin and fingernails. Sometimes we even observe so-called spoon-shaped fingernails. Something called angular cheilitis, which just refers to cracks and sores at the corners of the mouth. And dysphagia, not to be confused with dysphagia. Dysphagia is difficulty swallowing. Dysphagia is difficulty speaking. Glossitis is something we tend to see in more advanced stages. That's characterized by an enlarged, inflamed tongue. And that tongue usually tends to be a little sore. Something that's a little bit more controversial is a sign and symptom called pica. The reason it's controversial, just so you know, pica is basically the desire to consume non-food sources of minerals. Like, for example, a person might have the desire to chew on like a coin or something like that, or they might prefer the taste of it. This happens a lot in cases of pregnancy and things like that. The reason it's controversial mainly comes down to this. Pica is not very greatly associated with iron deficiency or any kind of mineral deficiency. It actually, in most people, seems to be kind of a fluke of biochemistry that changes during pregnancy and such or other periods of life. But so we're just gonna like relegate pica here to the bottom of the list. Okay, so a little bit of etiology or cause. Basically, what happens, you have low iron for whatever reason, whether it's excessive blood loss or just not getting enough from food or whatever. This then leads to poor oxygen availability, and that's because hemoglobin captures oxygen and helps transfer it, excuse me, throughout the body. And if you are lacking in iron, of course, you're going to have the inability to transport that oxygen very well. And usually, about 3 to 4 months later, you'll start showing signs and symptoms. Now, why is it 3 to 4 months later? Well, again, this is typical, but it's not always the case. Sometimes it can happen more rapidly. But the reason for the 3 to 4 months is that when you're talking about minerals in the body or fat soluble vitamins, a lot of them tend to build up kind of a reserve, and you won't see signs of deficiency really until that reserve has been used up, and sometimes that takes months. Okay, so a little bit more information here. Um, okay, so with iron deficiency anemia, it's often referred to as microcytic anemia. And microcytic basically just means small cell, micro, small, cytic cell. And it's compared to something called normocytic, which means like a normal size cell. And the reason it's microcytic, you can think about this is just really you're talking about removing a bunch of iron ions as well as oxygen molecules and from the hemoglobin, and the result is you're going to have smaller volume, right? So, and this also relates to the size of the cell and the volume of the cell. So here's a handy little picture here of hemoglobin. You can kind of see how complex its little twisty, turny, tubular structure is. And you can actually see the iron right here. It's denoted by Fe2 plus. Fe2 plus just refers to an iron ion. Um, yep, there we go. Okay, so some prevalence. Men, not really at high risk. There's a number of reasons for this. We don't really get pregnant and things like that that would increase our blood volume and dilute our iron stores. We also tend not to menstruate. There's not a whole lot of risk here for low iron, not to mention men tend to eat more meat and such, more calories, period. The people who are most at risk tend to be African American and Mexican American women. Their prevalence of iron deficiency among them tends to be around 20%, which is rather high. You can think of it as almost one quarter of women, which is remarkable. Caucasian women, a comparably lower risk, but still rather high, especially compared to men, 9 to 12%. So it's just something to keep in mind. It's very common. Okay, risk factors. If you are pregnant, again, we alluded to this, you tend to increase blood volume when you're pregnant. And as you can imagine, say you fill a glass with Kool-Aid powder, the more water you add, the more diluted it's going to be. Same goes with iron. And we actually call this relative anemia for that reason. Okay. And breastfeeding is another risk factor, and it's just owes to the fact that you have increased needs for iron when you're breastfeeding. If we're talking a child that's greater than 6 months old, often it's common to have iron deficiency anemia with something we kind of coin and we call this milk anemia, because what happens is with excessive cow's milk, it tends to crowd out iron containing foods out of the diet, and therefore you end up with iron deficiency anemia in these young kids. Heavy menstruation because of the blood loss and all the iron that's lost in that. Adolescent girls are increased risk, and this is for several reasons. One is because they have increased needs for their growth, and also they tend to be a very common population with restrictive dieting practices. Obviously, there's a lot of body shaming, a lot of sort of body conscientiousness among girls of that age. And so we want to promote a healthy body image and not these restrictive diets. Chronic bleeding is another issue. This may occur with ulcers, so sometimes doctors will conduct a test to look for H. pylori, which is a common cause of stomach ulcers. Um, Also, if you have certain types of gut cancers that results in bleeding in the gut. If a person is a vegan or vegetarian and they are not following the guidance of, say, a registered dietitian or somebody who's informed on the subject, they can run into a lot of trouble by not balancing their diet well to prevent this. Malabsorption and impaired gut, this is going to be a common factor when it comes to vitamin and mineral deficiency. Okay, so treatment of iron deficiency anemia generally includes treating any underlying medical causes, like, for example, if there is malabsorption or some sort of a cancer. Supplementation may be required. In extreme cases, IV infusion may be required, but this is kind of rare. Another thing you can do here is you can combine iron foods with vitamin C containing foods. It's actually the acid, the absorbic acid in vitamin C, seems to be especially good at helping to foster the breakdown of iron um, in the diet. Going on here, you can also, again, I mentioned this before, you can combine heme and non-heme sources together. That applies to omnivores, obviously, not your vegetarians. Please like and subscribe if you like this and you want to hear more updates from this channel. Thank you again, and here are some references/resources for you. And I even put in parentheses what I used it for, so that way you've got a little guidance. Thank you, everyone.